Well, hello everyone. Thanks for joining us today for a webinar on discovering the future of medical documentation. I'll start off by introducing myself. My name is Joshua Seguin. I'm an AI sales consultant at the Wellstar team. A couple webinar logistics before we get started. All attendees will be in listen-only mode. We are recording this webinar, so it'll be available to you all after the event. If you have any questions during the webinar, please submit your question in the Q&A feature, which you'll see at the bottom or the top of the Zoom there, and you can feel free to share any questions you have. We'll make some time for them at the end. Here's our agenda for today. First off, we'll go through a brief product overview of what Nexus AI is and how the tool works. We'll move into a product demonstration with the help of my colleague Ryan today, and we'll show you how the tool works in action. And then we'll close things off with the Q&A session to answer some questions you may have about the tool, the funding, or how to leverage this in your practice. I want to touch briefly on a subject that I'm sure many of you are all too familiar with in physician burnout. In recent years, there's been a surge in discussions on the subject, and the occurrence of burnout is steadily increasing. According to some recent statistics that we put up on the screen here, 53% of physicians reported experiencing burnout, that's in 2021, which is a huge increase from just 22%, which was reported in 2018. And additionally, 60% of physicians have stated that their mental health had worsened since the onset of the pandemic. Some of the factors that are contributing to this burnout, they include increased patient volumes, time spent on documentation after hours, and the ongoing administrative complexities of managing a practice today. Not only does burnout impact a doctor's health and well-being, but it can also lead to heightened medical errors and a diminished quality of care. So the demand for efficient documentation methods has never been more important, and achieving a balance between delivering top-tier patient care and managing this ever-expanding administrative workload calls for a solution and streamlined and effective solutions, rather. And so innovative approaches like our AI scribe are emerging as promising solutions to help physicians save time on administrative tasks and streamline their documentation. This encompasses everything from diagnostic notes to patient histories and, of course, encounter notes. So what is an ambient scribe? Well, an AI scribe is simply a tool that's capable of listening to your patient encounters and automatically generating a clinical note for you. We're going to see this live in action in the demo, but to share some more context, essentially what's happening is Nexus AI, this AI scribe tool in your EMR, will listen to your patient-physician encounter. It'll process the conversation to sort out weekend and weather and small talk from what's medically relevant, and it'll produce a structured SOAP note for you, or whatever desired template you're looking for. We'll touch on that in a bit. And the outcome is a summarized clinical note with medically relevant context for you to copy and paste or soon push right into the EMR. I also wanted to spend some time to talk about what AI is capable of and what the limitations are as well. We get a lot of questions on that. And so, as I mentioned, the AI scribe's capable of transcribing patient encounters in real time. It'll generate structured notes for you, like your SOAP notes. It's capable of integrating in EMRs for seamless documentation. And it's also capable of learning and adapting to provider preferences over time. Some things that AI is not capable of yet is fully replacing clinical judgment or documentation review. Can't handle highly complex or fragmented encounters without oversight. And it doesn't operate without occasional human correction. So while the tool is designed to enable you, it can get you 99% of the way there. It's not going to be taking anyone's job. So let's take a look at Nexus AI Here it is in the screenshot we can see on the screen here. This is our AI scribe that in this case is toggled on in the EMR and lives out of the way in the corner until it's opened up on the screen to look like this. It sits on top of the EMR, doesn't impact your ability to use the EMR while it's running. So you can minimize it even while it's in use, so you can navigate Oscar Pro as you typically would when a patient's in your exam room. We've touched on the tool's capability in general, but what does this translate to for an impact that it has for physicians? We have a few points here that we're going to dive into deeper detail on through our quantification, through our pilots. But in short, it'll save you 2 hours per day on your patient charting. It improves the patient experience, and it can reduce the burnout for physicians and administrators. Like I said, we're going to dive deeper into that after the demo, but I wanted to just kind of share a bit of what that impact really translates to. So let's cover the main features or key features of Nexus AI, starting with the most important one, and this is an enhanced note quality. The quality of the AI that we have in this tool does cost a little bit more money to operate, but it's an investment that Well has made as it's better for the user by improving the ability of the AI to capture the notes accurately and avoid including information or hallucinations that shouldn't be in the notes. And why this is so important is because of the roadmap and the vision that we have for this tool. So as it stands right now, it'll summarize your notes for you. But with that enhanced note quality and accuracy, we'll then be able to, in Oscar Pro, draft your prescription for you, draft your lab orders for you, draft your referral letters for you as well. In the demo, we'll see this will come together a little bit more, but it's really important that if you did discuss a prescription with a patient, that's accurately noted so that our next step of drafting that prescription in Oscar is there ready for you to send off and save to the chart, and it's accurate. Another really key feature is our templates. They are fully customizable, so we understand that SOAP notes are important, but some of you may prefer a different style of note, so we've removed all limitations here. We have over 75 existing templates in the drop-down menu for you to select after a note, and you can simply create your own if you'd like as well. So you can submit an example, tell us the headers you'd like your note organized into, or how you'd like your note to turn out, and we'll be able to design that for you and add it to your account. This can be done on a clinic level as well. The next point here is referral letters, patient handout documentation. After the SOAP note's done, many clinicians like to generate a referral letter or a consult letter or some type of e-form, and you're able to do so with the click of a button. We've added a patient handout option as well, so after your note's done, you can click a button to get a take-home action list, which is summarizing for your patients what's important for them to take home and remember to do. Multilingual support. This is by popular request. We have 35 plus languages that we support. You can have a conversation in up to 4 selected languages with your patients. I'm going to show you this in the settings tab later. But when you have a conversation in any of those 4 selected languages, the notes will come out in English afterwards. We do have EMR integration, of course. The tool's already integrated into Oscar Pro. And if you're on Oscar Pro, we can simply toggle this for you, toggle it on for you rather. If you prefer to use it outside of Oscar Pro, we do have a web address that you can use as a standalone app. It can also be supported on mobile phones too. Your account syncs across anywhere that you log in. So you could, in theory, take a note on your mobile phone on the go into Oscar after, pop open that note, and copy and paste it into the patient's chart. Safety and security is also a popular topic and a key feature to cover here. I want to mention that Well Health, as being a publicly traded company, we own Ocean, Doctor Care, multiple EMRs, we own over 200 clinics across Canada, and cybersecurity companies. So we don't take lightly that this tool is only valuable to you if it's safe for use for the clinicians and for the patients. We'll touch more on what this looks like later as well. So now, the moment you've all been waiting for, the live demo. I'm going to have Ryan show up on screen here in a second and change my screen share and walk you through what this tool looks like in Oscar Pro and a basic example case as well. So bear with me a second. change my screen share. Here we are. See that okay, Ryan?
Yep.
Awesome. So the screen should look familiar to everyone. When you open up a patient's e-chart, you'll see this new icon here, which is Nexus AI. You can simply pop this open and you'll be able to start using the tool as you please. There's a few features I'll walk through before diving into the demo just to kind of get ourselves oriented with the tool. We have a new note tab, which you can click on to start any new encounter with the patient. We have an encounter history tab here, which you can use to track down any previous encounters, date and time stamped, and we have the ability to label as well. You can search up a previous patient by their label, and it'll pop up for you. And then the last tab is the settings tab here. In here, you can go through to customize how those notes come out for you. We'll touch on patient consent before we get started. You can choose if you'd like an encounter timestamp on there. We do have the languages available here. I'm just going to do a slow scroll through. This is being recorded. You can refer back to it or ask us questions, but these are the languages we have available for use. You can select up to 4 of them. The notes will come out in English. Here's where you can customize a template, or you can ask us to help you customize one as well. And then we have our default note settings right here. So diving into a new note, first topic to cover is patient consent. For those who haven't heard about it, it is important to let the patient know that you are using this tool for note taking. So Ryan, let's do a role play example here. I'll play the physician, you can play the patient. I'll say thanks for coming in today, Ryan. I'm using Nexus AI, my scribe in the background. It's taking notes for me. It helps me save time. Is that okay with you?
Yes, that's fine.
Okay, great. So then I'll click this button here and it'll begin my recording. Just before, just bear with me, Ryan. A couple more features to cover before diving in. We also have the ability to label, which I mentioned. So I might on here put Ryan's patient initials in case I don't copy and paste the note right away. We have a scratch pad here where you can jot down any important notes. Perhaps you could copy and paste a medication list or patient history. And we have some feedback here at the bottom showing that it's capturing this conversation. And then before I click that stop button, uh, we'll have our conversation and then it'll produce the note. So yeah, thanks for coming in, Ryan. What brings you in today?
I've had a sore throat for the last 5 days, as well as a really bad cough and a runny nose.
Oh, sorry to hear. Are there any other symptoms that you've been experiencing?
Just the cough and the runny nose. I have noticed I've been really hot as well. I'm not sure if I have a fever or not, though.
Okay. Are you on any other medications?
No, I'm not right now.
No? Do you have any allergies?
No medical allergies, no.
No? Okay. Well, yeah, what I'll go ahead and do is just take a look at you here, Ryan. We'll get to the bottom of this here for you. I'm just going to take a look down your throat. Okay, I can see some redness and swelling and some exudate on your tonsils here. I'll take a look at your ears here. All clear. Let's get some vitals for you as well. I'm just going to get your temperature. Okay, it's 38.2 degrees. It's a bit high. You've got a bit of a fever. Um, let me go ahead and also get your blood pressure here. It's 120/80, so that's good. And your pulse is 70, so that's good as well. You mentioned you've had this for 5 days. Has it been getting worse, or do you find it's about the same, or how's it
Uh,
progressed?
well, my daughter was sick before me. She had a sick throat and was diagnosed with strep throat. And then mine, just over the last 5 days, is just steadily getting worse. So I figured it'd be best to come in and see you as well.
Okay, yeah, that's important to know. Yeah, from what I can see here, Ryan, it looks like you've got a strep throat. So what I'd like to do is prescribe you penicillin to take 3 times daily for the next 10 days, 500 milligrams. Make sure you complete the course of your medication. You can come back and see me if things aren't getting any better. You can also do salt water gargles and drink warm fluids like tea. That'll help with the sore throat. Does that all make sense? Is there anything else I can go over with you today?
No, that's good. Thank you so much.
Yeah, I know when you walked in, you mentioned you had a bit of an issue with your knee. Can I ask you a little bit more about that? Was that from an injury that took place or an incident?
Yeah, it's something that took place back when I was playing competitive sport, and it's just been bothering me ever since. And now with my old age, it seems to be getting a little bit worse for me.
Okay. Well, was there any particular, incident that made it feel worse, or do you think it's just over time that it's been an issue?
I'm noticing it when I'm lifting weights, especially working on legs. It seems to be more painful, especially on the calf of my knee.
Okay. All right. Well, let me take a look at your knee here and just do some range of motion and testing with you and see if we can't get that sorted out for you today as well. So I'm just going to do some range of motion with you here. Let me know if you feel any pain. Oh, all looks good. Okay. Do you feel any pain when I'm pressing around your knee here as well?
No, no current pain.
No, no pain. Okay. I'm gonna do a couple of tests here. I'm just gonna do a McMurray test on you here. Okay, that's we've got a positive there, so it might be something tissue related, maybe your meniscus. And I'm also gonna do a Lockman test here just to rule out that it's ACL. Okay, so that's negative, so that's good. You know what, Ryan? I would like to send you off to a physiotherapist to get a better look at this. I think you may have some meniscal damage there. So I'm going to get you a referral to a clinic down the road to get you in with a physio to take a better look at this and to put you on a plan to get you back up to speed. And hopefully we can get rid of that pain for you. Uh,
Perfect. That sounds great.
yeah. Is there anything else I can go over with you?
Nope, that's it. Thank you.
No? Okay, perfect. So at this point, I can click the stop button here and it'll take a moment to produce my SOAP note. It'll organize by issue, and then I can simply click this copy button here, move over to my notes section, and paste it in. So let's take a second to review what this note looks like. You can see here we've got the sore throat, bad cough, captured some family history in there as well, the knee pain. Here's our objective section, which is typically general for the examination. Got our assessment, which are those two main issues we covered, and our plan here as well. Prescription and a referral. The last two notes you'll see here are optional to include from the settings tab, but it does mention that you gathered patient consent and it includes a date and time stamp on here as well. Of course, you can edit these notes prior to copying and pasting. You can type in here anywhere or after the fact. And then some other features to go over here. We do have a transcript you can refer back to. So if you want to see what details we spoke about in verbatim transcription, you can take a look here. You can also generate any other templates you might be looking for. So I know I have to generate a referral letter for Ryan. So now I might have either my custom referral letter in here or this generic referral template. The tool is smart enough, as you can see, to pick out the relevant details that I mentioned are important for the referral. So it picked out what was relevant to the knee pain because that's what I said I was referring him for. And we can see all the relevant details that we'd want included in sending that off. So now my next step might be to copy and paste this to my referral that I do send off. Soon enough, like I mentioned with the roadmap, this will automatically be drafted in Oscar Pro for you. We also have a patient handout. So in case Ryan isn't good with remembering next steps, I might print him out one of these. It's a nice summary of his action items for a take home. So he'll remember everything he needs to do and all the relevant next steps. I might copy and paste this to a message I send out or an email, or maybe a printout for him to walk out with today. Now, if I didn't copy and paste that note right away, we can see it's here, RC, date and time, in my history tab, so I can always come back at lunch or end of the day to copy and paste it over. So that's the product demo and everything that I wanted to go through with you. I do have some more slides to get back to, and I can see that Q&A feature rolling in, so feel free to keep those questions coming. Just going to move over to a screen share back to our slideshow. There we are. So demo's done. Move on. Here we are. So this is something I had mentioned briefly earlier, but I really wanted to talk about how we've quantified how this tool has a major impact for providers. First and foremost is the improved efficiency. Out of the gates, we've noticed that patients or physicians were able to save 3.5 minutes per patient encounter, translating to roughly 2 hours per day or 10 to 12 hours per week. We're able to alleviate 85% of the cognitive load, right? Less recalling details, less recalling patient encounters, and transferring notes over later. The improved quality of patient interactions was something that was actually a positive to come out of this that was an initial intent for the design of these tools. And that's that patients actually had a significant increase in comfort and satisfaction when interacting with physicians that were less distracted by typing or formatting or jotting down notes, and more focused directly on them, trusting that a tool was capturing these notes in the background. We also did have, I mentioned here, 78% of interactions were perceived to even strengthen the physician-patient relationship. That's a nice factor too. Improved accuracy and documentation quality. We did receive a 95% accuracy rate, and that was in transcribing complex medical terminology. This helps reduce the risks of errors and omissions. And the consistency is something that you can trust to properly format your notes, not only in a SOAP format, but any template that you might be looking for. The next slide here, I touch on privacy and security. This is always a question we get, so I want to read off a few points. Of course, we do have the PHIPAA and PIPEDA approvals. The data is hosted on Canadian servers. It's a Canadian scribe, Canadian company built by Canadian physicians and researchers. The data is stored for 48 hours. That's our default setting. You can absolutely delete sooner if you need to. We were approved by the OMD in their pilot, of course, this Canada Health InfoWay funding, which I'll touch on the next slide, and major health authorities across Canada as well. So we are absolutely safe to use for Canadian providers and patients. Now, a little bit about this Canada Health InfoWay AI scribe program. So Nexus AI is a pre-qualified vendor for the Canada Health InfoWay AI scribe program. The program will fully fund up to 10,000 one-year AI scribe licenses. This applies to eligible primary care clinicians. It officially opens in June. So here we are, as there are a set number of available licenses for this program. We do encourage you to express your interest to learn more and be notified as soon as enrollment opens for this national program. So conveniently, on our next slide here, we have a QR code, which you can scan to express your interest, to set up trial access or be submitted for the funding. So if you'd like, you can go ahead and open up your phone right now, scan this QR code, and then we'll be following up with you about trial access and submission for funding. This is also going to be available on our next screen. I'll jump to, so we don't have to stay on that screen too long. This is our Q&A session we've arrived at now. I'm going to pop open the Q&A feature, read through, answer some of the questions that have come in if we have time for it. Everybody will get an answer, whether it's in the session today or by follow-up. And we'll cover some Q&A here. This is the same QR code that you can scan to express your interest for the funding or the free trial for Nexus AI. So just popping open the wrong panel here first. And then I will pop open the Q&A feature, which I'm supposed to. Just bear with me a second. There it is. Okay. Questions here. If you're using a smartphone to capture the visit because you're not in front of a computer, how can you copy and paste to your EMR? That's a great question. So this tool is available in Oscar Pro, in the web app, and on your mobile phone as well. It's all linked to your account. So if you do an encounter on your mobile phone, You can absolutely log in an Oscar after. You'll see it in the history tab, so you can copy and paste that note in inside the EMR. I have a question here about where is the data stored. So it is adheres to all regulations needed for Canadian practitioners. It's stored in Canada, of course, which is part of the regulations that we have to hit and the PHIPAA and PIPEDA certifications too. What happens if I'm using Zoom for virtual visits? Does the scribe work in the background? This is a great question, and I'll expand on this one. Absolutely, it does work for video calls or even phone calls. The one kind of detail to be aware of is that you do need to have it as ambient noise, or in other words, if you're doing a phone call visit and letting your computer listen on the scribe, it's important that that phone call is on a speakerphone conversation. If it's in your headphones, it won't actually pick up both sides of the conversation. It'll just hear yours. So that is an important detail. Same thing for the video call here. As you just saw, Ryan and I were on a video call and it picked up both sides of the conversation and worked really well. Does the data store after deleted? Great question. It is stored temporarily for that 48 hours while it's shown in your history tab. After that point, it's fully deleted. So any audio, transcript, or note is deleted entirely. How much is the cost after the trial period? And is it per provider, per clinic? So the website advertised pricing for Nexus AI is 129 monthly. However, with the Canada Health InfoWay funding, ideally we can get you applied and covered for a full year subscription. After that, if there's another funding program that comes out, of course we can reapply you for that. But otherwise, it would be the 129 monthly per provider. We do have per clinic enterprise deals available as well, so you can reach out to our team or myself, and we can help you get some answers on what that might look like. Question about microphones or hardware. So a microphone, of course, does need to pick up the conversation. So this will work with any built-in microphone on the phone, laptop, or exam room computer. If the exam room computers don't have a microphone built in, what we've done is recommended to some of our clinics to purchase a cheap USB plug-in ambient microphone to enable that computer to use the scribe. We can provide our recommendations if you'd like. You can reach out to us and we can share that with you. A question here about templates. So I've mentioned earlier the default setting is a SOAP note, but we can absolutely accommodate other templates. So if we've been working a lot with the specialists as well outside of the Canada Health InfoWay funding program. They can submit any particular template just by outlining the headers and the context they like to see under each. We can have that added to your account. So you can simply click on that or have it as a default. So when you're done with the patient, your note comes up in your desired template, whether that's a referral or consult letter or something other than a SOAP. Billing codes question. This is an interesting question, actually. We in our pipeline have a feature that we're really excited about, but we don't have a release date on yet. Soon down the road, we will be able to evaluate what possible billing codes were mentioned in that visit with the patient to give you some insights in there and possibly allow you to select the most profitable billing code of all the possible ones from an encounter. I think that's what the billing code question is referring to. That's the type of insight that we'd be able to help with. A question here about the languages. So we do have 35 plus languages that we're capable with. I scrolled through really quickly. If you're looking for one in particular, feel free to reach out and we can tell you if it's capable or not and set you up with trial access for you to test it out too. Can the AI handle counseling encounters or mental health applications? Yes, it can. We can have a custom template for you And we've rolled this out to a number of mental health providers and got positive feedback around it. One step I recommend starting with is to meet with us or ask us to design the templates for you. That way, when you get started on your trial access, you can have a DAP note or some other specific note to how you'd like your encounter to be arranged. But absolutely, it works well for those applications. I think I've covered most of these. Do we have a sign for the office that states an AI scribe is being used? This is a good question. We do have poster material that we've shared with some of our clinics. This is something that we'll communicate with clinic managers at well clinics if it's a well specific question for outside of our well clinic network. You can also reach out to us for that type of material. We can share some posters with you to put up around the office to help inform patients. Absolutely. Funding plans for specialists. Unfortunately, the Canada Health Infoway program is designed for eligible primary care providers. This does include, NPs and RPNs in rural areas. If you have a question and you're on the fence of thinking whether you'd be eligible or not, let me know and I can share the exact language with you and getting communication after our webinar today. Could a specialist do the trial? Yeah, absolutely. We have a free trial month for whether you're involved in the Canada Health Infoway funding or not. So you can have a month to test out the tool, let it prove to you that it saves you time before subscribing. And then we can go over costs at that point. Like I mentioned, it's the 129 monthly per provider. Alrighty. If I'm missing any questions here, we are going to send out communication afterwards. So not to worry. If your question's been missed today, we absolutely will get back to you. I'll try to answer a couple more before we finish out here. A question about pediatricians. They are included in the Canada Health Infoway funding. There are some kind of written guidelines on what that looks like. So if you're a pediatrician and you're looking to get this set up, reach out to us and we can let you know if you can get applied for that funding and set you up on a free trial. Yeah. You can do that by scanning this QR code that's still on the screen, by the way. So if you're unsure on the fence, feel free to scan it. At least you'll get a reach out and some questions answered before that deadline to get this funding in, which starts in June, by the way. Patients often jump around with issues. Talk about issue 1, then 3, then 2, then 4. Yeah, that's of course a scenario that we've tested out. I know in today's example, we kind of went through 1 all the way through and then a secondary issue all the way through. But this works really well for patients jumping around. What the AI does after the fact is it takes the transcript and it sorts out by issue and by header how that SOAP note should be arranged. So like you saw in the example there, when it says S1, S2, regardless of order of conversation, it'll be sorted relevant to each header and each issue. Alrighty. I think I'm gonna call it there. I've got a couple of more questions. I think we've covered most of this. If we did miss any of your questions, I'm just gonna move to the next slide here. We will be available. You can either reach out to us, reach out to me, or scan that code, and we'll be in touch to answer any questions. We'll also have some follow-up after. As I mentioned, this webinar is recorded. So if you've missed any parts of it or want to rewind and take a look at a certain section, you'll be able to. But at this point, well, thank you for joining and thanks for spending some time with us this afternoon. I hope that Nexus AI is a good fit for you. We'll leave the screen on for a few seconds, but thank you very much, everyone, for joining, and thanks for your time today.